Most patients hate repeating the history that they have to give to different healthcare professionals over and over again. But there is a reason for this, and it actually benefits you. And I didn't learn this until I spoke to a consultant in acute medicine when I was working there as a junior doctor, that I realized how important this was. So I'm Dr. Matthew Gloudeman, been a doctor for nearly a decade, and I know how frustrating this can be. A lot of my patients will openly express how annoyed they are that they have to answer the same questions over and over. But in this video, I'm going to walk you through, one, why different clinicians have different perspectives and it's important for them to ask these questions. Two, how your story actually evolves without you knowing about it, a lot of times. And three, that these multiple perspectives, one of the questions that a doctor asks or a healthcare professional asks could change your outcomes for the benefit of you. So, first, you need to understand that every doctor has a different perspective, different clinical background. For context, for me personally, I've worked in pediatrics, acute medicine, general surgery, orthopedics and trauma, palliative care, old age psychiatry, geriatric medicine, urgent care, general practice, crisis work. I've done urology, ENT. Not many doctors have that wide and varied experience, but every patient that sees me is going to get a little element of all of those specialties, and I have a fresh look compared to somebody else that's had different clinical experience, different training. And the way I think about it, I mean, from medical school, you almost like cram all this information in your head like jigsaw puzzle pieces that don't really fit. And then you start your career and then they start to evolve. And then every clinician, they have this like beautiful picture in their mind of how to support different patients with different disease patterns and different conditions. So that unique perspective is really important, and them having a fresh look at you each time is really important as well, because they're taking it from their lens, their angle, the mentors they've had throughout their entire career. Second thing is, your history will naturally evolve. And this is the thing I alluded to when I talked to this senior consultant. So I remember I took a really good history, was quite proud of like the things that I was doing. I asked a question, and then the same consultant a few hours later asked the exact same or almost the exact same question, and the answer was completely different from the patient. And afterwards I said, like, I asked that question, they said something different. And this consultant said to me, it was really important for me to understand, was that a patient will think about all the questions that are asked of them in between times. So maybe you start your journey seeing a family medicine doctor and they think you need to go to the hospital. So they've asked you a few questions, then you're waiting until the ambulance crew arrives, and then the ambulance crew is going to ask you a few questions. Then you're waiting until you see an A&E doctor, and they're going to ask you a few questions. And each stop along that journey, you're then thinking about all these questions, and then maybe thinking, oh, was it a little bit different? And you're answering it differently. And by the time, hopefully, you get to the most senior person, maybe it's an acute medical doctor. If you're going into the hospital under that team, you'll see a junior doctor or a registrar first. You're going to be able to package the information, and all of the other doctors have taken their fresh perspective on things, and then you're going to be able to answer some of their targeted questions that might change the outcome for you completely. So all of these perspectives matter, and any one of those people along that journey might ask the one critical question that could change outcomes significantly. I'll give you an example. In my career, there was a patient, saw a doctor in the community, thought they were having a heart attack, saw the A&E team, same thing, saw the ambulance crew, same thing. And then I asked one slightly different question, which was, are you having ripping pain in your chest? Because they were still in pain despite getting morphine and things. And they said, yeah, it actually feels like a ripping pain. And that worried me a lot, because that might mean aortic dissection. So like tearing sensation is really worrying for us. It's different than a heart attack. So we organized a quick CT scan, confirmed it, and then they rushed up to the ITU unit, the intensive care unit, and then quickly got to a tertiary center, meaning a center where they could do cardiothoracic surgery for that patient. And that's why multiple perspectives are really important, because every doctor is going to take a unique lens, a different lens. They might ask that one critical question that can actually change outcomes for patients. So I know that the thought of having to repeat a history over and over again is sometimes annoying, frustrating, but it often leads to the best outcomes. So bear with us while we're asking you questions, and I hope this video helps you understand that a little bit better.